What is hypertrophic cardiomyopathy? Well, hypertrophic cardiomyopathy is a condition where your heart muscle is abnormally thick, which makes it a lot harder to pump blood throughout your body. Usually, in most cases, the septum between the ventricles is thicker than usual and can block blood from flowing out of the heart into the aorta. This is called obstructive hypertrophic cardiomyopathy. Without any blockage, it's called non-obstructive hypertrophic cardiomyopathy, but the left ventricle can become stiff, which prevents the heart from relaxing. This reduces the ventricle's blood capacity and amount of blood being delivered to the rest of the body. Some people have an abnormal arrangement of their heart muscle cells, which can possibly lead to arrhythmia. The modes of inheritance for this disease are through gene mutations, through family, and if one parent has it, you have a 50% chance of getting it as well. The signs and symptoms for this condition are possibly none, but they're also possibly developed. Some examples include shortness of breath, chest pain, which is heightened during exercise, fainting, heart murmur, irregular, fast fluttering or pounding heartbeats, problems with heart function causing possibly fatal heart rhythms, and it can also possibly cause sudden cardiac death. Some complications that this condition causes are atrial fibrillation, which is thickened muscle and abnormal arrangement of the heart cells. This can change how the heart functions, causing irregular heartbeats and possibly blood clots, which can lead to strokes. Blood flow is blocked, which causes shortness of breath, chest pain, nausea, and perhaps fainting. The mitral valve can possibly be affected by it, and it may not close like it should, causing blood to potentially leak backwards into the left ventricle from the left atrium. Dilated cardiomyopathy, which is where the ventricle becomes bigger, which lessens the force of pumping. It can cause heart failure, as the heart can become too stiff to be able to pump enough blood for the rest of the body. And it's rare, but it can cause sudden cardiac death. It can happen to people of any and all ages. There are no specific medications for this disease, but some treatments include changing your lifestyle, which is recommended for those who don't have symptoms, as well as medications that are meant for certain conditions contributing to cardiovascular disease. Using medications and having procedures is meant for those with symptoms. Some medications are beta blockers, calcium channel blockers, and diuretics. They allow for temporary relief of the symptoms, but they have their own side effects. There are also procedures that you can get, which some examples are septal myectomy, which is surgery meant for those who have obstructive hypertrophic cardiomyopathy and extreme symptoms. It's mostly meant for those who are younger, whose medications aren't working well. The procedure is to remove a part of the septum in the left ventricle, which improves blood flow. There's also alcohol septal ablation, which is not surgery, but it's meant for older patients with other diseases as well. The procedure is to inject ethanol through a tube into the artery, which supplies blood for the thickened heart muscle. The ethanol kills those cells and the tissue shrinks to a more average size. There's implantable cardioverter defibrillator, which is an ICD. It helps to keep a normal heartbeat using electric shocks when it's irregular, which makes it less likely for sudden cardiac death. There's a pacemaker, which sends electrical impulses to keep the heart beating normally. There's a cardiac resynchronization therapy, which is called CRT. It coordinates the right and left ventricles' contractions. And there's a heart transplant if it comes to extreme measures. The frequency in the population is 1 in every 500 people, which means 0.2% of the population. A large percentage of people with HCM are undiagnosed as well. 2/3 of people have obstructive, and 1/3 have non-obstructive hypertrophic cardiomyopathy. Some interesting facts about this disease are that people with this heart condition are hard to diagnose because the symptoms are very minuscule, therefore making it hard to realize that they have it. Some people can go through their entire life without knowing that they actually have it. It can also get worse over time, despite not having many symptoms or health risks. It can lead to worse quality of life because of long-term complications or be a monetary burden. And it can cause sudden cardiac death in even the most active, youngest people. That's all about hypertrophic cardiomyopathy. Hope you enjoyed. Bye-bye.